Do you have neck pain and you've had x-rays,
but you have no idea what it means?
So today we're going to go through that for you. We're going to go over a neck pain x-ray report.
Hi, I'm Dr. Josh.
Hi, I'm Dr. Kristina.
And we're chiropractors in Newmarket, Ontario, Canada.
Welcome to our channel. Great, so today on our video we're going to look at neck x-rays and answer the question if we can even see pain on a neck x-ray. And as chiropractors, what are we looking for when we're looking at x-rays?
So be sure to hit the subscribe button and the bell icon to be notified for any new videos that get posted. So let's get on with the show. So this is a normal x-ray of a neck. And so there's a couple things that we look for when you look at an x-ray is what does the structure look like, the posture. So you have a nice C shape in the neck and the neck follows it exactly the same. So that tells us that the alignment is good in the spine. Mm-hmm. We can also see other things as far as the spaces between the joints. That tells us how the discs are. Mm-hmm. And there's all the bone looks very uniform in its color. So that tells us that there's no bone laid down and the bone is normal.
Yep. If anything starts to go, and progress, so there are different stages of progress in terms of arthritis in the neck. So once you start to have more white patches of bone, especially around the joints, so in the back along where the facet joints are, so there's a lot of joints along the back of the neck, obviously to help mobility, we can tell if it starts to degenerate. And we can start to tell as well if there are bone spurs that start to develop. So those are progressive levels of degeneration in the neck. But so far, this neck x-ray looks quite healthy.
Now, when we're talking about the normal spine, the one thing I want to highlight is probably the one thing that you can't see, and that's your spinal cord.
Yeah.
So inside your spinal canal lives your spinal cord, and it's attached to your brain. And so when we have that perfect alignment, then we know that your spinal cord is relaxed. Mm-hmm. So that tells us that the information that's in your brain is able to travel from the brain down the spinal cord to the rest of your body. And that's a good thing. And that's why we highlight good position is we want to make sure that your spinal cord is healthy.
Yes.
So this would be an x-ray that's not so good. Mm-hmm. And you can tell the alignment, the curve is gone. And not only that, it has a lot of the features that Dr. Kristina mentioned previously. The bone is changing, we have bone spurs, the space between the joints are lower, mm-hmm. They're getting compressed, and there's a lot more white in the bone, which means we know we have some inflammation, chronic bone laydown, and so this is a very unhealthy spine. Now with this x-ray, we see the degeneration, but again, most important thing we want to focus on is what does the spinal cord look like? And you can imagine if you have that much degeneration and that postural abnormality, then the spinal cord definitely is not as healthy as it should. It doesn't have the space that it needs, and it's actually even getting shifted. It's not going relaxed, it's actually getting pinched or getting choked in that middle part of the spine. Mm-hmm. We call that word stenosis. So anytime you hear the word stenosis, yes, that means that the space where your spinal cord lives is actually smaller than it should. And any stenosis is not a good thing, because you don't want to lose any space for your spinal cord, because that will affect the information getting from the brain to the body. Yeah. So looking at these two x-rays side by side, basically, we couldn't tell you exactly if one person's in pain and one person's other pain, because guess what? Pain is a personal experience. It's what you are actually going to feel. So what we do know is that if you do have damage, the chances of you having pain and having problems and having symptoms are greater.
Yeah.
So it's good probability that you're going to feel it, but it doesn't necessarily mean you're going to have it.
So yeah, in terms of degeneration, as we see more degenerative changes in terms of the bone, so the disc height narrowing, the sclerosis in the bone, so showing more inflammation, and just the curvature, the posture of the spine itself starts to move and shift forward. Yes, things are having to adapt to that, and you will most likely have pain from that. Mm-hmm. However, we have had patients who've had really bad x-rays and they don't really feel any pain. Mm-hmm. They might have a little discomfort, right? Mm-hmm. And you're thinking, oh my gosh, these people how are they not completely disabled? And again, you'll have people with really good looking spines and they're in a significant amount of pain. So you really can't 100% judge how a patient's going to feel based on their X-ray. But we really just want to focus on the structure. We care about the pain, but our main focus is the structure and the function of the spine. We want to get that working as best we can, so then the overall body can function at its best. And then eventually all their organ systems and everything will be functioning well also.
Now, if you don't have access to your X-rays and all you get is the printout report, well, printed out X-ray reports usually follow the same guidelines.
Yeah.
We call it the ABCs. And what that is each section is broken down into what you're looking at. So the first is the A, which is alignment. How is the spine aligned, right? And so there'll be a comment about that. Then there's going to be a comment about how the bone looks. So is there arthritis? Is there bone spurs? The density of the bone. Do you have osteoporosis, osteopenia? Those are lightening of bones, or is it whiter? And then after that, we have the C. We don't see cartilage on X-ray, but we can see the spaces where the cartilage is. So in the facet joints and in the disc space. So how do they look? Do you have disc compression? Do you have facet arthrosis or arthritis? And the last one is soft tissue. What does the soft tissue look like? Do you have calcifications in different areas of the bone, around the spine? Is there calcification in spots that you shouldn't have it? Or are they metal objects? Maybe they might find something, for example, like a surgical clip they might see, and they'll make note of that. That's contained in the soft tissue. So if you don't have the X-ray, but you have the ABCS, that can give you an idea of how much damage is present in your spine too as well.
That's it. And words they might use are degenerative joint disease, degenerative disc disease. You might hear those words and the different grades that they give them. So that'll tell you basically how advanced your arthritis might be. However, when medical system is looking at an X-ray, they're looking at it slightly differently than us as a chiropractor. They might see your arthritis and be, oh, that's normal. So they might just say normal arthritic changes to the spine. But for us, that's really important information, and we don't consider it normal at all. And so we really want to know what grade you're at and how we can assist you with that. But yeah, just to give you an idea that we look at it a little differently. So there you have it. That's our video for today on neck X-ray. And if you can see pain on a neck X-ray and what we're looking for on the X-ray as well. If you have any more questions or comments about it, please leave it below, and we can get back to you about that, or even make another video about this later on if you have a lot of questions. Please don't forget to subscribe and hit that bell icon so you can be notified every time we upload a video. And please don't forget to share our video with friends and family, anybody you feel could benefit from this. So thank you so much again for watching, and we'll see you on the next video. Bye.
Bye.